Did you ever wonder why Joe Namath pitches Medicare Advantage plans? In the next 5 minutes, you're going to understand why, while learning about the underpinnings of the Medicare market that will help you understand the different Medicare-related options out there. Everything I discuss here is going to be at a high level, meant to help give you a conceptual framework. None of it should be construed as advice. In this episode, I'm going to cover, first, how Medicare supplements work. Second, how Medicare Advantage plans work. And then third, why it's difficult to compare the two. And then, with these things in mind, I'll explain why you see Joe Namath pitching Medicare Advantage plans. So let's get started. First, how Medicare supplements work. The law that created Medicare was passed back in 1965. Part A covers hospital expenses, and Part B covers doctor expenses. Part A and Part B together are referred to as Original Medicare. Now, Original Medicare has gaps in what it covers. The insurance industry created insurance plans back in the 1960s designed to supplement Medicare by covering the gaps. These Medicare supplements, also sometimes referred to as Medigap plans, were and continue to be popular as people worry about being exposed to the gaps in Original Medicare. The vast majority of medical providers are in-network with Medicare, and if the provider is in-network with Medicare, it's also in-network with your Medicare supplement. When you have a medical expense, most of the claim is going to be paid by the government via Original Medicare. Your Medicare supplement is only going to pay anything if part of your original expense falls into one of Original Medicare's gaps. It's relatively easy as an insurance broker to offer Medicare supplements. Even a home and auto insurance broker who doesn't deal much in health insurance will often offer Medicare supplements. So with that little bit in mind about Medicare supplements, let's talk about how Medicare Advantage plans work. So Medicare Advantage plans did not come along until around 2003. When you choose a Medicare Advantage plan, the government no longer pays your claims covered by Medicare Parts A and B directly. Instead, the insurance company pays them. As a result, the insurance company takes on a lot more risk with Medicare Advantage than with a Medicare supplement. Now you might be wondering, why would the Medicare Advantage insurance company agree to pay all of the claims that are covered by Medicare Parts A and B? Good question. It's because the government pays the Medicare Advantage insurance company a lot of money per beneficiary who signs up for the Medicare Advantage plan. That's why the Medicare Advantage plan agrees to take on that risk. A little bit more about Medicare Advantage. Medicare Advantage insurance companies can have networks, and they can implement care coordination and other innovations that can improve care and lower costs. The nature of the program also creates an incentive for Medicare Advantage insurance companies to try to only sign up healthy Medicare beneficiaries. Partly for that reason, Medicare Advantage plans are highly regulated by the government. Those regulations extend to how the plans are marketed. Because of these regulations, most insurance brokers do not offer them. And if they do, it's a lot harder for them to do so than with a Medicare supplement. That gets into why it's difficult to compare Medicare supplements to Medicare Advantage. Most insurance brokers who can help clients with a Medicare supplement are not credentialed to be able to help a client with a Medicare Advantage plan and be paid a commission. As a result, they generally are not in a position to be able to compare the two very effectively for clients. Regulations also make it hard to do so. Given the sheer number of options out there and the different circumstances clients often have, most brokers simply conclude that they can't do it and make it work for their business. So what does all this have to do with Joe Namath? Well, while most brokers cannot help clients with Medicare Advantage, it's still a very attractive market for insurance companies, in part because these plans are best for a lot of people. As a result, specialized brokers have emerged who specialize in Medicare Advantage plans. These specialized brokers have national call centers or relationships with more localized firms staffed with licensed agents who focus on Medicare Advantage. These firms will often get huge amounts of marketing money from the insurance companies to help specifically with the cost of mass marketing Medicare Advantage plans in order to drive awareness and leads. Some of that marketing money goes to pay celebrities, such as Joe Namath, to pitch the plans. And that's why you see Joe Namath and other celebrities pitching Medicare on TV. Just contact your relationship manager for details on how to set up a consultation with us.